Hello, my name is Melinda Frost, and I'm with the World Health Organization, and I'm the lead Risk Communications Officer for the COVID-19 response. As we have already learned in Module 2, WHO has released a practical guide for UN country teams, the operational planning guidelines to support country preparedness and response. This guide is intended to provide immediate support to governments and partners in implementing their COVID-19 country plans. This will be operational from now until April 30th. The country guidelines are structured along 8 key pillars of public health response. Pillars are operationalized by actions to be taken to enhance country preparedness. The focus today is Pillar 2, risk communication and community engagement. With this video, we will describe the actions to be taken within this pillar. This is relevant at the country or sub-country level for governments, the UN country teams, and partners. The goal is that after watching this video, you will be able to conduct your own assessment using the WHO online planning tool for COVID-19. In Module 2, we presented high-level actions and recommendations of Pillar 2, emphasizing the importance of transparency of communication to the public with elements of responsiveness, empathy, and appropriateness according to a country's culture. We described that a country's level of preparedness should also be made public information. Let's try to now take a deeper look at practices. There will be 3 levels of preparedness in risk communication and community engagement, starting from the very basic, level 1, up into sustainability, level 3. At first level, countries should implement a national risk communication and community engagement plan for COVID-19. Details of anticipated public health measures should be included using the existing procedures for pandemic influenza, if they're available. In the early stages of preparedness and response, countries should also conduct rapid behavioral assessments using, for example, the Risk Communication and Community Engagement Action Plan that can be found on the WHO website to understand key target audience perceptions, concerns, influencers, and preferred communication channels. Local messages can be prepared and pre-tested through participatory processes, specifically targeting key stakeholders and at-risk groups. It is critical to identify trusted community groups. Those are local influencers such as community leaders, religious leaders, health workers, community volunteers, etc., and local networks such as women's groups, youth groups, business, traditional healers, etc., to ensure effectiveness of communication and community engagement. At second level, established preparedness includes timely dissemination of messages and materials in local language through adapted communication channels. Countries should develop communication materials with the support of public health and healthcare networks at the national and subnational level. Additionally, they should work with community-based networks such as local non-governmental organizations, school systems, and municipalities. Other sectors include business, travel and tourism, and food and agriculture sectors. The most important thing is that we see all of these sectors and all of these entities as amplifiers of information. So it's critical to ensure that they have consistent information and recommendations to give to the population. Countries should favor 2-way channels for community and public information sharing. Examples are hotlines, responsive social media, and radio shows. Ideally, systems should be in place to detect and rapidly respond to misinformation and disinformation. By establishing large-scale community engagement for social and behavioral change approaches, countries can ensure that community and individual health and hygiene practices are in line with the national public health containment recommendations. Third-level actions, when risk communication and community engagement is sustained, take account of systematic community information sharing and feedback mechanisms. This can be done through social media monitoring, community perceptions, knowledge, attitude, and practice surveys, as well as information of questions and answers coming directly from healthcare professionals in the field. Most importantly, changes to your risk communication and community engagement response should be based on evidence and needs. These must be culturally appropriate and empathetic. Most importantly, changes to risk communication and community engagement approaches should be based on evidence and needs. All of these approaches must be culturally appropriate and empathetic. Lastly, lessons learned should really be documented to inform future preparedness and response actions. Now that you've watched this video, you should be able to describe each key action in risk communication and community engagement and be ready to assess whether each has already been or needs to be implemented at a country or sub-country level. It is important to keep in mind that the actions presented in this video are a guide and should not supersede existing national guidance and plans. It should be used to rapidly adapt existing relevant national plans and accelerate preparedness. For more information, you may access the Operational Planning Guidelines in the Additional Resources section of the training platform. You are now ready to begin the assessment using the WHO online planning tool for COVID-19. Thank you for watching this video.